Hey everyone, and welcome. Today we're going to talk about a medication that did more than just show up to the fight against type 2 diabetes. It actually helped rewrite the rulebook. I'm talking about canagliflozin, which you might know as Invokana.
But first, let me ask you something. What if a single pill for diabetes could do way more than just lower your blood sugar? What if it could also act as a bodyguard for your heart and your kidneys? That's the big idea here, and it's exactly why this drug is such a big deal. So here's what we're going to cover. We'll start with what canagliflozin is, then get into how it works its magic. After that, we'll look at the amazing benefits that go beyond blood sugar. Of course, we have to talk about the warnings and side effects, and we'll wrap up with the nitty-gritty on dosage and drug interactions. All right, let's get into it.
Okay, so first things first, what is this stuff? Well, to put it simply, canagliflozin was a real trailblazer.
It's a pill you take, and it's part of a class of drugs called SGLT2 inhibitors. Now, that's a mouthful. It stands for sodium glucose cotransporter 2 inhibitors. The key thing to know is that when the FDA gave it the green light back in 2013, it was the first of its kind. It really introduced a brand new way of looking at diabetes treatment. And this is really the key takeaway. Before this, the main goal was just to get that A1C number down, right? But with canagliflozin and the drugs that followed, the whole strategy changed. It became about so much more than blood sugar. It became about actively protecting your heart and your kidneys for the long haul. So you're probably wondering, how does it actually do all that? Well, the secret, it's all about the kidneys. Okay, let's break this down because it's actually pretty clever. Your kidneys are constantly filtering your blood, and that includes glucose. Now, think of these things called SGLT2 transporters as sugar gates. Their job is to grab about 90% of that filtered sugar and pull it right back into your body. What canagliflozin does is pretty simple. It blocks those gates. It literally slams the gates shut. So what happens to all that extra sugar? It can't get back in, so it gets flushed right out of your body when you pee. And the best part? This whole process works completely separate from insulin. And because of this really unique way it works, the benefits start to stack up, and they go way beyond just managing blood sugar. In fact, the FDA has given it its stamp of approval for 3 really big things. Number 1, the original job, getting blood sugar under control. Number 2, and this is huge, reducing the risk of major heart problems like heart attacks and strokes. And number 3, protecting against serious kidney disease and even hospitalization for heart failure for some people. Let's dig into each of these a little more. So first up, its main gig, controlling blood sugar. And remember how we said it works independently of insulin? That's a huge plus, because it means it can be a really effective tool no matter where someone is in their journey with type 2 diabetes. But here's where things get really interesting. We're talking about heart protection. Major studies, the big ones, proved that this medication can seriously lower the risk of a heart attack, a stroke, or other cardiovascular events for people who have both type 2 diabetes and a history of heart disease. That was an absolute game changer in the field. And it doesn't stop there. It also acts like a shield for your kidneys. For folks dealing with diabetic kidney disease, it's been shown to actually slow down the damage, which is incredible. This can mean reducing the chances of needing something as serious as dialysis or a kidney transplant down the line. Okay, so we've talked about all these amazing benefits. But as with any powerful medication, we absolutely have to talk about the other side of the coin, the risks and potential side effects. It's super important to be aware of these. So let's go through the most serious warnings you need to discuss with your doctor. First is something called ketoacidosis. It's a very serious condition, and what's tricky is that it can happen even when blood sugar levels look normal. Next, there's a heightened risk of lower limb amputations. This risk is highest for people who already have issues like peripheral vascular disease or neuropathy, so routine, careful foot care is just non-negotiable. Then there's volume depletion. Because the drug makes you urinate more, it can lead to dehydration and low blood pressure, so you've got to make sure you stay hydrated. And lastly, there's an increased risk for UTIs, which can sometimes become quite serious. Look, all of these are things you absolutely must talk through with your doctor. Now, on to the more common side effects, which are usually not as severe. It makes sense, right? With more sugar in the urine, you create an environment where yeast can grow. So unfortunately, genital yeast infections are the #1 most common side effect for both women and men. On top of that, you might also see more urinary tract infections and, as you'd expect, just having to go to the bathroom more often. Okay, so let's shift gears and talk about how to use it safely and effectively. That starts with getting the dosage right. Typically, you'd start with a 100 milligram pill once a day, and it's really important to take it before your first meal.
Now, if everything's going well and you still need a little more help with blood sugar, your doctor might bump you up to the 300 milligram dose.
But here's something that is absolutely critical to understand. The dose isn't the same for everyone. It all comes down to your kidney function. Doctors measure this with something called an eGFR. Think of it as a report card for your kidneys. If your kidneys are working well, that's an eGFR of 60 or more, then the standard 100 to 300 milligram dose is fine. But if your kidney function is a bit lower, between 30 and 60, you can't go higher than 100 milligrams. And if your eGFR drops below 30, you shouldn't even start this medication. And for anyone on dialysis, it's a definite no-go.
We also have to talk about how it plays with other drugs. This is super important. Some drugs, like certain antibiotics, can actually make canagliflozin work less effectively. On the flip side, it can cause levels of other medications, like digoxin for the heart, to go up, or levels of lithium to go down. And here's a big one. If you're taking it with insulin, you have a much higher risk of hypoglycemia, low blood sugar, so your doctor might need to lower your insulin dose to keep things balanced. This quote really sums it all up perfectly. Canagliflozin didn't just tweak diabetes management, it redefined it. It showed that we can have a medicine that doesn't just lower a number on a lab report. It can offer deep, meaningful protection for two of our most vital organs, the heart and the kidneys.
So this all leads to the big question, doesn't it? With all these powerful benefits, but also these very real risks, could this medication be the right fit for you?
And of course, that's a question only you and your doctor can answer together. Our goal here was just to give you the information you need, to arm you with the knowledge so you can have a really productive, informed conversation with them. Thanks so much for joining me today.